I'm Alex. I'm with the Franciscan Working Well team, and I'm going to talk to you guys about Healthy Access, something that LUM has signed up for, so you guys are now eligible for as employees, and it'll be starting September 1st. Does everybody have the packets in front of them?
Yes.
Yeah.
Okay. So just really quickly, Healthy Access, it's a point of care advanced primary care model provided by your employer. Essentially what that means is it is point of care just means your first stop. So usually a primary care provider, your family physician, family nurse practitioner, whomever. And then advanced primary care is just a newer care model where it's team medicine. So instead of having that one individual physician or provider that you see for everything, there's a team of providers and medical staff available to you, because you might not always need a physician. It might be something as simple as, you just want to get your BMI done. That would only require a medical assistant or an LPN instead of a nurse practitioner, a physician's assistant, or physician. So it aims to make primary health care much more accessible to you as an individual, both cost-wise and then scheduling-wise. So the advanced primary care is really designed to take care of that scheduling aspect. With that being said, in terms of that extended access, instead of having one clinic that you need to go to, one employer clinic, you'll have access to 17 clinics across Indiana. Here in the greater Lafayette area, there'll be two. There's one across from the Walmart on Veterans Parkway, over on Daughtery Lane, next to Legacy Pub, if you're familiar with that area. And then our newest one is our West Lafayette clinic, which is at 925 Sagamore Parkway. It's next to the new pizza place that just opened, as well as the Franciscan Express Care and advanced imaging station that's already there. Then we also have ones in Crawfordsville and Carmel, and kind of in that surrounding area, with the rest of our Working Well locations being in Northwest Indiana and then on the south side of Indianapolis. So who is all eligible for Healthy Access, if you guys choose to sign up? So you, the employer, your spouse, and then any dependents you have up to the age of 26. Now, two special notes that I would say are, when it comes to dependents, if you consider them a dependent and they are under the age of 26, then we do as well. So that can be if you're taking care of your nieces and nephews over the summer, they'll be staying with you and you want them to have access to that primary care. You can add them to your Healthy Access plan. It's no additional cost for you or for LUM. The cost is just per employer, and then it includes a spouse and then all the dependents. In terms of spouse, one question I did get asked yesterday, when I was working with a different company, is fiancés or extended living girlfriends or boyfriends. If you consider them a spouse, we will also consider them a spouse as well. So it's more, I would say, best way to describe it is a loosely based honor system in that sense. Now you can't, unfortunately, come into the clinic and tell us that you have 13 to 14 spouses. We are going to put a cap on that. But in terms of dependents, there's no cap. We have some employees that have 10 dependents on their account with them. So that's kind of just like who is included in this. And then I already kind of talked a little bit about the different physical locations across Indiana, but you also have access to virtual healthcare. So that's virtual healthcare for both physical and mental health. On the physical side, there are limitations to it, just like all virtual physical care. And you're limited by what the doctor is able to see over the telehealth service. So it's dependent on your phone's camera, their ability to actually see. Strep throat is something that's easily diagnosed virtually, but soreness or neck pain, something where they might need to be hands-on with you. They very well could just end up recommending you come to the clinic to be seen. Now, let's say that does happen. Ideally, we want you to schedule an appointment. It's always better to schedule an appointment, less wait time for you. It kind of gives us more of a heads up so we can staff appropriately. But with Healthy Access, you're always accepted as a walk-in. Now, we do strive to keep your wait times down. So the average wait time for a Healthy Access employee is under 20 minutes in the waiting room. But there have been instances where we've had one provider and every exam room filled up with, because while also treating Healthy Access patients, they are also seeing DOT, patients, as well as work comp injuries, stuff like that. So, there's only so much one provider can do. So your wait time might extend, but on average, we try to keep you as little as possible. We know you have to get on with your day. So our goal is to have you in and out of the clinic within 45 minutes. Now, obviously, if it's more severe and you need to spend more time with the provider, we're going to prioritize that, but we do prioritize your time when it comes to visiting the clinics. And then the mental health aspect, so that is done virtually through using Franciscan's EAP service. There is a limit right now of 3 appointments per individual. So that's not per employee. That would be per you, per your spouse, or per each of your dependents. And then that resets at the beginning of every year. And that's really it's our initial introduction into offering the virtual health services. We do hope to expand it at the beginning of next year to an unlimited cap, if not at the very least 5. But it's us making sure that there is a need for mental health services with the advanced primary care model. So what's included in the actual visit when you go to visit HEALTHeACCESS? So it'll include 54 of your most common labs. So that'll be your CMPs, your CBCs with differentials, which is going to be all your blood work. A number of titers, which are just basically checks you to make sure that you have a vaccination or don't have a vaccination, as well as 65 of the most common medications for acute and chronic care. Now, that means that 65 medications that are included in your HEALTHeACCESS membership, so no cost to you. Now, if you do need a medication that is not included in our formulary, we're still happy to write the prescription for you, but it would just need to be filled through your insurance company or paid out of pocket if you don't have insurance currently. And then it does also include the most common immunizations you need annually or for work, for kids for school, stuff like that. So your Hep A, your Hep B, as well as your annual flu shots, and a host of other vaccines that you may or may not need. Varicella is on there is a common one. And so that's kind of that standard of care, or what you would normally see with through a provider. So if you can get it done at your family care provider, it is covered under your HEALTHeACCESS. Now, let's say that you come in, let's just say you have a child, they're playing on a playground, they fall, they break their arm, or they think they might have broken their arm, and you want to bring them into working well. We're happy to see them. We do include x-rays are covered in your HEALTHeACCESS. So we're happy to get an x-ray done for them, have a provider take a look at it. Now, if we can fix it and it's a minor fracture or just a soreness, and we can put them in a splint, we'll send them on their way. You're good to go. Now, if it's more advanced, let's say it's a compound fracture and it will need a specialist, that is where the HEALTHeACCESS coverage ends, and then your insurance or your out-of-pocket would need to take effect. It does not cover anything like prenatal specialists, orthopedics, or bariatrics, or anything like that. But if the best way I can describe it is, if we can do it in the clinic, it's not going to cost you anything. And if it ever is to cost you anything, we let you know ahead of time and upfront, and we always work with you to get the best deal. So whether that be through your own personal PBM referrals that we have throughout the healthcare network, and it doesn't have to be Franciscan. If you prefer IU, Eskenazi, Witham, Parkview, I know just announced a hospital that they'll be building in Lafayette. Any of these health networks, we're happy to work with. Which leads me to your health data. Your health data it's not the property of Franciscans. It's not the property of LUMS. It is yours. And so one of the first things we'll do on your initial visit is get you set up on the MyChart app. And that's to make sure that you have ownership of your health records so that you can take them wherever you want to whichever providers or specialists that you need to. So that's, including if you're with HEALTHeACCESS, if you're not with HEALTHeACCESS, those records are yours for your life, because that's your health information. And then the last thing I wanted to touch on, and then I'll open it up for questions, is just extended hours and aftercare. So let's say that something happens when a working well location isn't open. You are then also able to use the express care. So there's one next to our West Lafayette location, a Franciscan Express Care that you can use for acute care. So same thing, x-rays are covered, acute care, so injuries, sickness, anything like that. The one thing that is not covered, or they'll send you to the working wall in the future for, is to get medications refilled. And then for chronic pain, chronic, not just pain, but also chronic disease management. So if it's an ongoing issue, they can see you, but they can't refill your meds just because they don't keep them stocked there. And really, for continuing care for something with chronic, like a chronic diagnosis, you really want that to be the same provider ideally. So that's why we do it only in the working well clinics. But if you're not feeling well, if you're burning up, something happens over the weekend, maybe you go to a Purdue game, you fall down the bleachers or something like that. With Healthy Access, you're able to just go to that Express Care and be seen at no additional charge to you. The only thing that we ask is make sure that you tell them that you are a Healthy Access member. Otherwise, their instinct is to bill your insurance rather than Healthy Access. So that's just the biggest thing when it comes to the after hours Express Care. And then the last thing I want to point out before I open it up to questions is if everyone could just turn to page 1 in your book. You'll see it should say contact your Healthy Access Healthcare Coordinator, and then it'll have a number for Central and Western. That is going to be Sherry, your Healthy Access Coordinator. She's going to be your main point of contact. She'll be the person scheduling for you, letting you know if something's covered under Healthy Access or not. And then also, if it's not covered under Healthy Access, exploring your different options with you to get to see a specialist, whether it be, again, at IU with them, Eskenazi, Parkview, Ascension, wherever you prefer. So she's our referral expert, and she also is just really manages your Healthy Access accounts as a patient. So with that, I'd like to open up to any questions.
So I know we had a lot of questions on Monday about if you already have a primary care provider, if you have other insurance and how they work together. Do you want to talk a little about that?
Yes. So if you have a primary care provider already, we don't ask you to give up your primary care provider. We are interested in working with your primary care provider. So the best way to keep it simple is keep your annual appointments with your primary care provider. But if it's, obviously call there first, see if you can be seen. If not, feel free to stop by a working well. We share all your information with your primary care provider. We'll ask you, do you have a primary care provider on your first visit? And then we'll kind of get that set up in the account so that we can make sure that we're sharing any updates or information with your primary care provider. And then let's say that your primary care provider wants to run some tests. So let's say you go in for your annual physical and you say, oh, well, I just want to check your A1C levels. He can then place the order, and then you can have the blood drawn at Working Well at no additional cost to you. And then those results would just be sent back to him. So we're happy to do any blood work that's included in those books that you have. If your primary care provider recommends it or believes it's necessary and it's in that book, if you bring it to Working Well, we should, as long as you tell him to send the orders to the Working Well, we should have them, and we are more than happy to draw them for you and then send him the results. But again, we don't want to replace your primary care provider. And we're always looking to coordinate with him, but we are happy to be an alternative if scheduling doesn't allow you to see him for whatever reason. Him or her, I'm sorry.
Yeah, and we talked about scheduling, and also just if you have a copay or a deductible that you would have to be out of pocket if you went to your regular primary care provider, you would not have that if you went to this clinic. So it's a way to save a little bit on that portion of primary care.
And then we also had questions last time about enrollment. So if someone doesn't choose to enroll right now, when's the next chance that they could?
So if you choose to not enroll right now, you are eligible to enroll next month. This is not a open enrollment period or anything like that where you're enrolled for a year or 2 years. This is a month-to-month basis. So all that we ask is that LUM sends us the updated roster of any changes. So anybody coming on the list, anybody falling off the list, by the 25th of every month after this. So as long as you get them that information, now if you have a deadline before that, obviously, whatever that deadline is, we just we need about 5 days to get everything updated and sorted out on our end or on the back end for the upcoming month. So if you decide that you don't want to start in September, but you try to get towards the end of the year and you're having family come stay with you for the holidays, something like that, it might be a good time to hop on for 2 months, and then you can always take yourself off.
Yeah,
So it gives you a lot of flexibility when you need it.
Yeah. So this is the form that you'll use right now to get started. You can use it to add somebody later. You can use it to take somebody off later. I have on here the 15th just to give us some buffer time to get everything organized and to Franciscan. So, so any changes by the 15th will take place on the 1st of the next month. And yeah, you can add or detract at any time. So, I mean, I'm personally hoping that people aren't doing that every month and going back and forth, just because that would be a headache for all of us really. But yeah, if you need to make a change, then you're welcome to do
If
that.
you don't have, like, some people don't have a healthcare provider, will you, if they go there, will they kind of like lead you to somebody that will help you with that?
So you want to answer that? Did you hear
No, what was the question?
Well, some people don't have their primary care physicians. What would you do when they come to see you, or do you have like a network of that you could refer somebody to?
So in that case, what would happen is Andrea, our lead provider, would become your primary care provider. Now, if you said, "Can you find me a primary care provider?" That's something that Sherry could help you with outside of the Healthy Access Network. Now, that's not going to be covered, unfortunately, but that is something that they're more than happy to do.
But this clinic can act as your
Okay,
Yes.
okay. I just wanted, because some people,
Yeah.
I know some people don't have a health, they
Right.
just, when they say they go either ER to the, urgent care, but yeah, some, they don't have a specific healthcare provider. Okay. I just
Yeah, so
wanted-
you don't need to have another primary care provider. If you have one, you can keep it, but you don't need that. They will
Okay,
act as
okay.
that if you need that.
The goal of Healthy Access is to offer something to everybody, regardless of your healthcare situation. So whether you have no insurance or you have the best insurance, just that flexibility as well as affordability and convenience to kind of offer everybody a little bit of something.
That's good.
Yeah, I mean, from Love's perspective, we would love to have the funds to provide health insurance to everybody.
Okay.
It doesn't fit well with the nonprofit budget very easily. But when we learned about this, we felt like it was a way to offer something that would help take some burden off, even if it's not the whole burden of full insurance. But that at least for in those cases where you might avoid going to the doctor because you're sick and you can't afford to go, or you don't want to have an ER bill or whatever, that
This is a way to keep you healthy.
if you feel a little bit healthier. Yeah, get
Okay,
your
I just wondered
vaccines,
about that.
get your antibiotics when you need them. You have your infection, your strep or whatever, and kind of meet that immediate need, hopefully. So. What other questions can we answer for you? Yeah, so you guys have the book. It's got kind of all the information. I repeated some of it in the papers. You have just to have a look at that, but it's a long list of labs, a long list of medications that you can get filled. So there's quite a few benefits that you can get just from going to that clinic. Anything that other than the virtual part, anything that can't happen in that building is going to be your cost or your other insurance. But if it can happen within in the box, so to speak, it will be covered completely by this program.
Thank you.
I think maybe Alex, you told me that if you have a regular prescription that they fill 90 days at a time.
Yes. Well, so yeah, as long as it's a prescription the provider feels comfortable filling. So a lot of your chronic illness management, stuff like that, be 90 days. If it's a controlled substance, so your ADHD medications, those are going to be every 30 days with a visit. The nice part is a visit doesn't cost you anything. Now the prescription will, unless you're on something like, I believe, Wellbutrin is on our list, but that's really the only psychoactive that we have.
But things like, I mean, I know I saw like some cholesterol medications,
Yes.
that kind of thing
Yeah.
that are on, that those could be filled by the clinic every 90 days, covered with.
The only thing our providers ask is that you give us 48 to 24 hours to make sure it gets filled. We get a lot of calls on Friday. People saying, "Hey, I'm completely out of this medication. Can I get it in the next 45 minutes?" And we do what we can to get it filled, but we do run out of medication from time to time too. So that's something that we can't always promise, but we really strive to get to you.
Any other questions that Alice can answer for us? All right. Thanks for your time.
All right.
Appreciate
Thank you.
you moving for us. And
Yeah, and if anybody has any more questions, please feel free to reach out. Even if your spouses or loved ones have questions about it, there's a part that you're afraid that you can't or that you don't want to misexplain to them. Please feel free to reach out to me. I'm more than happy to.
yeah, on that note, I don't know that we asked this before, but I mean, a spouse can call that number too. It does not need to be the employee that's
Absolutely.
right.
And even a dependent over the age of 18 can call too.
Okay.
Yeah.
Okay, great.
Thank you, guys.
Thank you.
Bye.
Thank you.